My name is Olga Lucia Torres. I'm currently an adjunct professor teaching narrative medicine at the CUNY School of Law. I am also what I call a health empowerment expert. I give talks at disability groups, patient advocacy groups, trying to empower patients to be what I call a professional patient, which for me is a patient that shows up prepared to their appointments and makes the most out of their doctor-patient interaction. To me, it could be the difference between life or death. I'm a brain injury survivor, and the brain injury happened as a result of, ultimately it was found to be medical negligence, but I think it was an issue of miscommunication, an issue of my not being taken seriously because I was a Spanish-speaking patient in a room full of other Spanish-speaking people, and that the doctors thought the nurses had taken care of something, the nurses thought the doctors had taken care of something. And so when I was able to recover from that, and here I was, an attorney by training, thinking they're gonna take care of me because the last thing they want is to mess up with an attorney, and I was a litigator, right? So when I was finally able to recover from the brain injury, which took 6 years, I had to learn how to walk, talk, and take care of myself again. I knew that something needed to change and shift in how I interacted with doctors. I also needed to build up trust again because I, as you can imagine, did not trust doctors after what happened. But I needed doctors to get better. And so my mindset around how can I create that trust, I started thinking, how do I do that? So for me, I said, well, doctors show up as professionals. So I, as a patient, need to also show up as a professional. So that's how I came up with this term for myself as a professional patient. It doesn't mean that I'm a professional, meaning I'm always at doctors. If anything, it's the opposite. If you're a professional patient, you make the most out of your doctor-patient interaction, and hopefully you can get fewer doctor's visits. As patients, there's so many things that we worry about when we're going to go visit a doctor, right? And statistically, we've been shown that our blood pressure goes up. So many things physiologically happen to us when we go see doctors. So I thought, well, how can I make this as simple as possible and that people can remember it? So I came up with HEAL, H-E-A-L. So H is for honor your and your doctor's time by showing up prepared. And you can show up prepared by, one of the ways is, obviously you can do online research, and I advocate creating a patient portal account with your doctor so that you can have access to your medical records. If you've had blood work done, you can go in, take a look, and prepare beforehand questions that you might have about your blood results, for example. And I also advocate for creating this document that I call medical resume, where you have your pertinent medical history. It's very helpful also in terms of not having to recreate the wheel and fill out all of your medicines you're taking, what are you allergic to, et cetera, when you go see another doctor. E is being an expert in your body. That means, when did your symptoms start? How long has it been hurting? Does it hurt less with certain activities? These are questions your doctor is going to ask, so be able to answer them so your doctor knows that you take your health seriously. A is for assemble. Doctors have their own healthcare team. We as patients should also assemble our own healthcare team. That means getting a group of people that you can trust. If you know that your mom is an alarmist, she should not be on your healthcare team, right? There should be people that are going to be calm, cool, collected, that can either help you prepare questions and concerns before you go to see the doctor, or afterwards as you're thinking of this is what my doctor recommended, is this a plan of action that I really want to do? Is this what the treatment plan that I want to actually move forward with? And L stands for listen. Make sure that you listen to your doctor and that you get all of your questions and concerns answered before you leave the doctor's office, because we all know that getting access to that doctor again usually entails another doctor's visit, and who wants to go through that trouble? The minute the doctor comes in, it makes a world of a difference if the doctor says, hi, good morning, good afternoon. And if you have rapport, there's no need to shake a hand, but if it's the first time you're meeting this patient, take the time to shake this person's hand. Greet the people that the patient came with, right? That's just common courtesy when you are meeting somebody for the first time, but very often forgotten by doctors in their rush, for whatever myriad of reasons, it doesn't, is often overlooked. And the second is for the doctor to just stop and make eye contact and just ask, what brings you here? What can I do for you? Right? Because they're service providers, right? And I think often doctors forget that without patients, they wouldn't have a service to provide. And so when I get a doctor who just stops and makes eye contact with me and asks, what brings you here? What can I do for you? And genuinely listens without interruption. And as I said on the panel, the study that just really blew my mind when I was doing research for my talks and for my TEDx talk, that says that when patients start to describe what brings them to the doctor's office, on average, doctors cut off patients within 12 seconds. But if patients were left to speak without interruption, they would stop speaking within 48 seconds. So all that means is if we let patients finish speaking, all it takes is 30 seconds for patients to feel like they're heard, for that trust relationship to start building, and for those bonds, lasting bonds that are, because it takes a while for that trust to really start, a real trust to form. But if you've cut me off, we're already off to a bad start, right? So if you ask that genuine question and then you don't interrupt me, we're off to a running start.